there sure could be a link between psoriasis and eczema. Psoriasis is just, patches of irritated skin, kind of scaly skin, and when we see that the skin is inflamed and irritated, it can be that it's coming into contact with an allergen from the outside world, and it can also be that the person is having kind of allergies on the inside or food sensitivities, or that their barrier, their protective GI lining that protects them from the outside world has been breached, and bad stuff could be getting into the body and creating inflammation in the form of psoriasis.
Pruritus, or itching, is a common symptom in many skin diseases. It can be incredibly debilitating, with a major impact on quality of life. When assessing patients with generalized itch, it is important to distinguish two main types of pruritus: pruritus from a skin disease or from another cause, including thyroid, liver, and kidney problems, and cancer. The first group are patients who are itchy because they have a skin disease, or a rash. These patients should have some signs of inflammation in their skin, such as redness, scaling, or edema. For these patients, treating their skin disease should also treat their itch. The second group consists of patients who are itchy without having a skin disease. These patients will either have normal appearing skin or will have changes in their skin from scratching. Clues to scratching include erosions in a linear array and the butterfly sign, when there is sparing of the scratch marks on the areas of the back that are difficult to reach. When you determine that a patient is itchy without having a skin disease, the next step is to determine the cause of their itch. Itch can be the result of many internal diseases, including renal failure, liver obstruction, thyroid disease, and cancers such as lymphoma. These patients need a thorough review of systems to search for an underlying cause. They also need a lab workup, including tests of renal and thyroid function, liver enzymes, bilirubin and bile acids, as well as a complete blood count. If an underlying disorder is found, it should be treated. However, generalized itch is often idiopathic, and in that case must be treated symptomatically.